I'm Dr. Alice Barsoumian, and I'm an adult infectious diseases physician here at Brooke Army Medical Center.
Hi, and I'm Megan Donahue, and I am a pediatric infectious diseases physician here at BAMC as well.
And we decided to come together again for another joint episode between adult and peds to really bridge the gap and bring you some updates about measles and answer any questions you may have.
Yeah, and this is especially relevant at the moment as we have an ongoing outbreak of measles in West Texas with over 120 cases as of earlier this week.
Yeah, measles is particularly dangerous because it's transmitted through airborne measures. So that means that the viral particles can hang out in the air, including in a room after a person has left, and infect people who are susceptible to the disease. So we are concerned about close contacts of persons with the West Texas measles outbreak, but you can certainly get it from international travel and exposure to people who are sick with measles around the world.
And what's really kind of impressive with that lingering infection is that someone with measles can infect up to 10 non-immune people per case. So you can kind of see that it can spread quickly if people are not already immune or protected against measles.
The other thing about the number of people infected is that you can transmit measles for days before you even recognize your syndrome as measles. So sometimes we feel sick. It's this time of year, it could be flu, could be allergies. You don't really get the distinctive rash for about 4 days after you've already been contagious.
Yeah, and then you continue to be contagious for another 4 days after you start having that rash.
Yeah.
So almost a little over a week that you remain contagious with measles.
Some of you may have seen the public health announcements for Texas area that itemized where a person who was infected with measles has traveled. When you're thinking about your risk of developing the disease, the symptoms can start if you're susceptible to measles between 7 and 21 days after that exposure. So that's really the window that we're thinking about when we're talking about measles exposure. And that's the time period that we're thinking about when we think about what kind of protective measures or quarantine measures to take if you're exposed.
Yeah. And really one of the best things you can do for protection is if you know you've been exposed to a measles case and you're within the first 72 hours of exposure, getting a measles vaccine can really help protect against measles infection if you have not previously had any measles vaccines.
Yeah, and for adults who were previously unvaccinated, if they get that vaccine within that 72-hour time frame, they don't actually need that quarantine. I don't know about children.
So that actually is true for children as well. If they can get that vaccine within that first 72 hours, children who are 1 year of age or older also don't have to quarantine. It's a little bit different though for younger children, especially for children under a year of age who are exposed to measles. They may not be able to fully prevent infection even with that vaccine in the first 72 hours after exposure. So those babies should remain in quarantine for the full 21 days from their last exposure. If it's been up to 6 days, so if it's been longer than 3 days but up to 6 days after exposure to measles, babies under a year of age can actually get pooled immunoglobulins to help protect them against measles too. And that's really the only option for babies less than 6 months of age who are exposed to measles is to get measles immunoglobulin. But all of those babies should also remain in home quarantine for 21 days.
Right, and that's certainly very disruptive for families. So trying to protect everyone who's not eligible yet for the vaccination by receiving your vaccination is part of one of the protective strategies.
Yeah, absolutely.
So for adults born before 1957, many of you guys will have already recalled having measles. My dad told me when he got measles, his parents exiled him to the basement, and it was in New York, and it was very cold there. And all of these stories of these childhood diseases I don't recall, luckily. So before 1957, naturally circulating measles is presumed to have given you natural immunity through naturally acquired infection. For other adults, if you get one dose of the MMR vaccine or MMRV vaccine, that confers about a 93% protection against measles disease. The complete series is 2 doses, 4 weeks apart. That confers about 97% protection. So 100%, out of 100 persons who have received both doses as adults, only 3 would get measles if exposed. So really super effective. When we think about vaccines in general, each vaccine has different performance. This is one of the most robust vaccine responses we have.
Yeah, that's awesome. And then for children, we routinely start measles vaccines for young children with their 12 to 15 month vaccine series. And then usually they get a second dose of measles vaccine when they're 4 years old. In outbreak settings, or if families are going to be traveling internationally, especially to areas where there is more measles at baseline, we can give a second measles vaccine as early as 28 days after that first dose. And then for high risk for exposure, so during outbreaks or with travel, we can give an early measles vaccine to infants ages 6 to 11 months. The important thing with that, though, is that babies don't respond as well to measles vaccine at that very young age, and so they should still get their routine shots after a year of age.
Oh, that's good to know. Yeah, I remember one time you were trying to tell me about vaccines when I was talking about vaccines for my children, and you were very much, it's not the weight of the baby, it's the maturity of the immune system, and that never left me.
Well, what's kind of amazing about our immune system is that babies actually get protective antibodies from their moms, and that's part of the reason why we don't have to vaccinate babies under age 6 months, is they have some measles protection that their moms gave them while they were growing and developing. And then part of the reason why they don't respond as well to that 6 to 11 month vaccine is they may actually still have some of that protection from mom that actually helps fight a little bit against the vaccine. But
yeah, I mean, we're certainly geeking out, but these are microscopic differences, and the biggest bang for your buck is to get everything on schedule. Yeah, that's for sure.
Absolutely.
I did want to, so that's the antibody transfer to your mom. That's if the mom already has antibodies, so if she's already been vaccinated. When moms are pregnant, we don't typically recommend vaccination with live viruses. This is a live attenuated virus, and so that is not something that pregnant moms can receive for the first time. So if there's a pregnant mom who has been, during a measles outbreak, it's important to surround her with people who've already been immunized to decrease her chance of acquisition.
Yeah, absolutely. And then once mom has had her baby, then to get measles vaccine herself for her own protection, but then to kind of help build that network around the baby as well.
Yeah. Immunocompromised patients can sometimes be excluded from receiving the MMR or MMRV vaccine. And so if you have an immunocompromising condition, it's always best to check with your doc. It's not 100%. There are some conditions that, if well controlled, can still receive these vaccines.
Yeah, no, that's an important point too. And your physician is very happy to talk with you about your individual risk factors for vaccine.
In our service members, we've seen very few outbreaks of measles because we've had a decades-long history of ensuring measles immunity through basic training and other accession pathways with MMR vaccine or with obtaining titers. A titers is a blood level of antibodies. So most of our military members are protected. However, you can always check your readiness on your individual medical readiness record, your IMR. The Navy, the Army, the Air Force have different ways of searching that. I also just checked last night on MHS Genesis patient portal to see my record in MHS Genesis, and everything on my IMR, although your mileage may vary, has been populated into my immunizations tab on that portal record. And finally, if you're unsure, have no record for whatever reason, you can get a blood test, talk with your doc about whether or not that's a good option for you, or perhaps they can verify your immunization record for you.
Yeah, important.
So after you've been exposed to measles, and if you're vulnerable, so you haven't gotten natural immunity, you haven't gotten vaccine-derived immunity, if you're vulnerable, we mentioned the 72 hours trying to get the measles vaccine, and if you can't get that, quarantine. You'd have to probably coordinate with your physician or with your employer for some of the details associated with that. What might be required.
Yeah, definitely.
Okay. There are no drugs that are used to treat measles. We usually treat it with supportive care, and so some of the symptoms, we mentioned the rash, but it's generally like on any other viral illness. Fevers, although they can be quite higher than in other illnesses. The rash, when it starts after a few days of symptoms. It may be around the hairline and then down through the body, but also cough, runny nose, red eyes.
And then you can also have some diarrhea with measles. Some complications from measles that are more common in the pediatric patients, especially children under age of 5, can include ear infections, pneumonia. They can have lesions of the eye itself with ulcerations of the eyeball that, if really progressive, can result in blindness. We don't see this as much in the United States, where adults and children have few vitamin deficiencies, but some of these complications in measles are worse if a patient has a vitamin A deficiency. So if we're treating a patient who has measles, who has suspected measles, one of the supplementary treatments is to provide vitamin A supplementation to try and avoid some of those complications.
Yeah. Now, it's important to note, though, that vitamin A supplementation does not prevent measles, and really the vaccine is the only way to do it if you were born after 1957.
Yeah, absolutely.
So rates of hospitalization can be quite high. About 20% of unprotected persons infected with measles will require hospitalization. Mortality is in previous years 1 to 3 deaths per 1,000 cases. So those are things to note. Because of the risks of these complications, this is not a situation in which a social gathering to promote measles exposures or a measles party is warranted. I know that some of us in the 80s had chickenpox parties. Chickenpox can be rarely dangerous, but is also a very different disease. So measles is far more dangerous, and so that's not something that we promote.
Yeah, important to try and avoid large group settings when measles is spreading.
Yes, that's true. I remember some outbreaks in the past at different amusement parks, which is wild because you think of them as being very outdoors. But certainly you have a lot of indoors while you're waiting for rides and things like that too.
Yeah,
the close quarters, those lines can be pretty close to each other. Well, I think that's all that we needed to. Diagnosis of measles. So your doc can diagnose measles. Your different MTF may have a different algorithm or flow chart on how to seek care if you think you have measles. If you're going to go in person to see your physician for a diagnosis, make sure to wear a mask. The mask can be just one of those over-the-counter masks but a surgical style mask. In general, that's probably not good enough for prevention, but it's probably good enough for not having you spread it. And then that can be diagnosed through swabs or blood tests, or just, in an outbreak scenario, potentially just on physical exam. But while those cases are still so low, we do like to have a confirmation.
Yeah, definitely. And it can also be helpful to let your clinic know if you are coming into clinic with concern for measles, so that they can help move you to an area within the clinic where you're going to minimize risk potentially of spreading to other patients in the facility.
Megan, that is the first time in Friday Facts for 4 years that my phone has rung during filming.
Yeah. But
well, I better get back to it. So, all right, everyone. Thanks for staying with us and hanging out with us while we are trying to give you some info about measles. And stay safe out there and have a great spring.
Yeah. Have a nice day.